Active Connections is a programme of work that seeks to better embed the use of physical activity within Hertfordshire's health systems. It's led by the Heart, Sport and Physical Activity Partnership and funded by the Hertfordshire County Council Public Health Team.
An important element of the Active Connections work is supporting primary care to become part of the Active Practice Charter. This is a simple but impactful accreditation process, evidencing efforts made to improve levels of physical activity and reduce sedentary behaviour for both staff and for patients. Achieving active practice status encourages healthcare professionals to embrace physical activity when considering their patients' wellbeing as well as their own. Hatfield Primary Care Network were the first to achieve active practice status in Hertfordshire, which has had some fantastic early results.
So it's become clear to us working in healthcare that sitting is the new smoking. And we really want to do something to try and reverse that, and being an active practice is a major step in the right direction.
In terms of applying for Active Practice Charter, I took the lead on that, following close collaboration with Heart, Sport and Physical Activity Partnership, namely Tom, Zoe and Will. And I talked to our management team in the PCN and the practices, and they were very keen and open for us to get accreditation.
So one of the core takeaway benefits of being part of the Active Practice Charter is actually the mindset change of our staff. Starting with our staff first, their health and well-being is really important, and from then on we can much more effectively support our patients.
To reduce inactivity in patients, we've teamed up with local partners like Birchwood Leisure Centre or Hatfield Leisure Centre, and we are taking part in a GP exercise referral schemes. We also started our own health walk locally in Hatfield. It's led by our social prescribers, and we're having more and more patients signing up to taking part in the walk.
We have a very sedentary working life. I move from my desk 3 steps to my patient and maybe 4 steps to the couch. I'm active on my days off, but I wanted to see how we can improve activity within our practice. And I think it was no surprise to my colleagues that I was very enthusiastic at the thought of being an active practice. There's a website that has all of the physical activity in Hertfordshire, so I let them know about that so they can find something. And I try to bring it to whichever level of fitness that they're at. So if they do no exercise, we talk about getting out for a walk and how a brisk walk is as good as a run. And then I take my lead from them as to whether they're interested. Since we've signed up for the Active Practice Charter, I've been talking to staff about how we can be more active as a practice. I've got a sit-stand desk myself, and another partner has that as well. Other staff are now showing some interest in it, and they know they can use it when I'm not here. I've also bought a treadmill for our staff area, so staff can get up and be active throughout the day, and that's been really popular. People using it as a method of de-stressing after particularly challenging consultations or just being active at lunchtime.
So the STEPS challenge was just brilliant for the PCN and for the surgeries themselves, so we all got very excited. For myself, for the STEPS challenge, just really simple things like moving the car a bit further away, so parking kind of at the other end of the car park, and make sure that we're going out for some walks during lunchtime, so quite a few of us would go out for kind of walks around the town, and sometimes we would see little groups from the other surgeries in Hatfield going out for walks as well. We were just very supportive of each other kind of at the weekends, talking about walks that we've been doing and just really encouraging each other. So when we first heard about the Active Practice Charter, I think we were a little bit uncertain about how it would benefit us and our patients, but it has surpassed everything that we thought it would be. It's improved activity levels with our staff, as well as improving staff morale, improved teamwork across the practices as well, and it's definitely fed back to our patients, and we're all so much more aware of activity programmes that we can offer to them to help improve their overall health.
Our ambition is for all primary care networks in Hertfordshire to join the Active Practice Charter. So please contact the Heart, Sport and Physical Activity Partnership to find out how we can support you through the Active Connections programme.